but as I'm sure you're aware, it's a huge array of things that can happen on a boat. And so at the end of the talk, if there's something that's either happened to you guys or something that's on your mind that might happen, just ask me and we can go through that specific scenario as well, because it's, you know, like us, there's just so many different events that could happen, and I've tried to focus on what I think would be most common and also more common in the areas we're currently cruising. But yeah, so if you have any questions, just let me know. I thought I'd start just a little bit about me. I think most of you by now we've met briefly here and there, and you know that I'm a veterinarian. But I'm Australian, so I graduated in 2011. And I was working as a small animal veterinarian for 2 years in Australia, but then I actually worked as a wildlife veterinarian in Australia for 2 more years. Then I moved to China and worked as a veterinarian for Animals Asia, and they do bear rescue there. So in China, they do biofarming of bears, and so we were rescuing bears from biofarms and rehabilitating them. Unfortunately, they can't ever be released because they tend to be raised in the farms and are very accustomed to people, but we had a sanctuary we had 130 bears at one sanctuary and 120 at the other, and 2 vets, so we were very busy. Yeah.
So, what is a bile require?
The liver has the gallbladder, and it contains bile, and in China the bile is used for traditional medicine, and so sometimes they put indwelling catheters where they actually have a permanent opening going into that organ, or sometimes they actually just use needles to extract it every few days, but then the bile is used for traditional medicine, so it's used to treat liver disease, which it actually can help with, but there's synthetic versions nowadays that you don't need it. But it's also used for a lot of things that aren't, there's no science behind it, like putting eye drops and toothpaste and ointments and things like that. So yeah, we were rescuing bears and kind of doing a lot of education to try and reduce the practice. So it's still legal in China at the moment, but because of Animals Asia, it became illegal in Vietnam. I think it was in 2018. So it's, things are slowly changing. So so I've worked all over. I've started my career in Australia, but I've volunteered in Thailand. I've worked in Vietnam and China. I volunteered in Laos and Rarotonga. I have to look at it to remember. And then we got the boat in Panama, and so all up the coast we've done veterinary work, volunteer work in each country we visited. So from Panama all the way up here to Mexico. So basically, I've been working for 6 years as a vet, and I really loved what I did, but I found the industry of veterinary medicine sometimes not super fulfilling, because we'd sometimes have to turn animals away because of the cost of treating them and things like that, and I found that very hard. So basically, when we looked at buying a boat, I decided I'd like to do only non-profit and volunteer work with local communities where either they didn't have veterinarians, or perhaps people weren't able to afford to go to the veterinarians, to try and basically bring animal care and veterinary medical care to all animals instead of just the animals that could afford to go to veterinarians. We do obviously do like medical and surgical treatments of animals, but we also do a lot of education. So we've done workshops at different zoos on caring for animals and husbandry practices, but we also do training with local veterinarians, especially in Puerto Madero, where we just finished our 3-year refit. If any of you have gone through Puerto Madero and Chiapas, it's super rural. There's one veterinarian, her clinic is mostly just full of chickens. It's like literally full of chickens. And she just didn't have much small animal experience. She mostly had done stuff with cows and chickens, and they were really taught kind of the agricultural side of things, because that's where money is. So she was selling a lot of agricultural products, but everyone was bringing her dogs and cats, and so we just worked with her a lot to try and help her get better with her cat and dog medicine. But also started doing spay and neuter clinics and vaccine clinics and things like that in the area, so that was really cool. We treated, that number's a bit of an estimate, because with the vaccine clinics and spay and neuter clinics, we sometimes have like 100 dogs in a day, and so it's hard to know exactly how many we've done, but lots of animals over the last 5-6 years. And we run completely on donations, so it's been a whirlwind. Disclaimer. This is basically just to say that this talk isn't intended to replace veterinary care, and it's not intended for you to use this instead of going to a veterinarian if you can go to a veterinarian. Obviously, every animal is different, and so it's pretty general guidance that I can give you. We all have animals that might be on medication, or they might have something else wrong with them, and so it's really, really good idea that if you've got a good relationship with your vet, to run your plan past them of what you think you would, need in different emergency situations, and get the medicine that's appropriate to your pet in case they have something else going on that means they can't use what I've suggested. One of our things with veterinary medicine, like one of the oaths we take, one of the big things is first do no harm, and I just wanted to bring that up in that we always, if our pet's in trouble, we want to go to heroics. But it is important to remember that if you're not sure, you can sometimes do more damage than good by intervening. And so it's really important to ask yourself, and same with wild animals, if you find animals that need assistance, anywhere, ask, is what I'm doing definitely helping, or is it possible that I need to seek advice and things like that? Because we don't want to do anything to hurt them. This is our first aid kit. It's going to be really similar to your first aid kit, and in reality, you can use your first aid kit in an emergency. Probably don't want to share the thermometer. Would be a good idea to get the dog one. As many of you know, we take rectal temperatures in dogs and cats. A stethoscope isn't necessary, but it definitely is helpful because it means you can take your pet's heart rate. And usually you can feel the heartbeat, but obviously having a stethoscope, especially in an emergency, if it's a CPR type situation, would allow you to really check that there's definitely no heartbeat, or if there is one. For dogs, it is a good idea to carry a muzzle, even if your dog is the most loving creature in the world. If, for example, they fall and fracture a leg, they may bite just because they're in a lot of pain. So especially if you're trying to put a bandage on, having a muzzle so you can quickly put that on, do a treatment, and then take it off again is not a bad idea. Leashes could also be used though in an emergency, just simply tie it around their muzzle while you're doing the treatments. Basic bandage material, I've got a few examples here. Things I like. So a non-adherent dressing is just those ones that are shiny, and so that's just so it doesn't stick to the wound, but it's absorbent, so you can put it on a wound and it will absorb blood and gunk. But when you peel it off, it's not going to take the skin with it. Something like this, some sort of cotton or soft layer to use as the kind of intermediate, so you put your non-stick and then the cotton layer. And then this stuff is called vet wrap, and you can use the kind of stretchy elastic material that is in most human first aid kits. But this stuff is really great because it sticks to itself like that, but it doesn't stick to fur, and so it's very easy to get off, but it's also really easy to put on because it just sticks to itself, and so it's a really easy, it's called vet wrap or Coflex, but it's a really nice banding material for animals. Very easy to use, and it's easy to not, it's got a bit of stretch, so it's hard to make it so tight that you're going to cause a problem. Gauze and cotton balls are a good idea. I find this you can buy these gauzes from the Dr. Simi, and they're actually sterile, so you can use them to clean wounds and they've already been sterilised. And then there's just a single gauze in the packet, but a few of those aren't bad to have for wound cleaning. But it's also not a bad idea to have like a bigger packet because they're very good for bleeding. You can just hold them on and it's not going to dirty the wound and things like that. Disinfectant like iodine, chlorhexidine are the common ones. Antibacterial wound gel and ointment. Some saline is really good for flushing, or sterile water. Again, it's in most human first aid kits. But you can also buy, like my little drip bag there, you can get big bottles of saline like that that are sterile, and then you can just use a needle to draw out when you need to flush wounds. Towel for moving them, stopping blood, that kind of thing. Tweezers, forceps, and scissors. So it's really, for the most part, pretty similar to what you would have in your own first aid kit. Some special things that are specific for animals, though, is some medicines. So again, with all the medicines, it's a good idea to check with, if your dog's on any special, or cat's on any special medicine, to check all that, because some things do interact badly with different drugs. For example, metoclopramide in some border collies can cause problems because they are lacking a gene that metabolizes the drug. So there's little things like that that's good to know for your individual dog. We can definitely organise a copy of this for you guys too, so it's like it's a little bit more interesting. Yeah.
Isn't it sad that I already have all those because my dogs had to take just about every one?
Yeah, and that's what I was going to say. It's good to just keep, if your dog's ever on medicine, just keep it somewhere cool and dark, and it lasts a long time.
My poor dog, she's been to every vet all over the world.
Yeah. yeah, it's
But
yes,
where
they
do
do like to visit.
when we go to our vet to
Mhm.
get some of these?
Yes.
Is that what we?
So Serenia is just for dogs. It's not a human medicine and it's not a cat medicine. Serenia is really, really nice because it lasts for 24 hours and it's a very good anti-nausea drug. So that one can be really good for motion sickness, but also just for general nausea. Metoclopramide is a human drug and an animal drug, so it's one that you can just get over the counter at human pharmacy. So I've tried to put in things that when you are travelling in places that may not have some of these drugs that you may be able to find. Metoclopramide is also very good for motion sickness. It works in 10 to 15 minutes. Obviously, one hard thing with any oral antiemetic is if the dog is vomiting and it doesn't sit in their stomach long enough, it won't work. So if you're a veterinarian and you have a good relationship, injectables can be nice for vomiting. The one thing with metoclopramide is in puppies particularly, because they tend to eat silly things, if there's any chance of a blockage, it is a prokinetic, which means it gets the intestines and stomach moving strongly. So if there's a blockage and then you push on that really hard, it can cause problems. So again, it's where, do no harm. If you're not sure, better to not do anything. But these are very good, especially on a boat. Motion sickness is not uncommon. I think carrying a broad spectrum antibiotic like amoxicillin clavulanic acid is just a good broad spectrum antibiotic. It can be used for urinary tract infections, lung infections, skin infections. It just kind of covers a lot of things, and it's, I think, a good idea to carry a week's dose on the boat. So if you are over anywhere, your dog starts showing stuff, or cat shows signs of infection, you've got something like that. An anti-inflammatory is also a very good idea because it's pain relief. So, with injuries, it is a really nice thing to have. There's many different options. Meloxicam is, again, a drug that does come in a human form and is available over the counter. But for very small dogs, it'll be too big of a tablet and you'll probably need to get, like for a Barney-sized dog, you have to be splitting the tablet into like a 1/20th or something, so even less, he would take such a tiny amount. So some animals it is better to try and get the real deal. The main thing with cats and anti-inflammatories is their kidneys don't like them very much. So in cats, it's better to use them for a short period of time unless they're in a lot of pain. So if you do have cats on board, 2 to 3 days is probably a better time frame rather than having them on them for a long time. Activated charcoal is good for toxins like we use for the turtle. Nutrigel is a oral, it's like a liquid paste that has a lot of energy in it and vitamins. So basically if they're not eating, you can even just smear it on their tongue and it gives them glucose and energy. So you can use honey and things as well, but Nutrigel is a really good thing that can be syringe fed to dogs or cats that are feeling really sick. And then antihistamines, both of those antihistamines, diphenhydramine is Benadryl, and chlorpheniramine, both are human antihistamines. The really cool thing about Benadryl is it also works for motion sickness. So again, easy medicine to have on the boat that can be used in dogs and cats.
Question, you've had a lot of trouble getting the cat to take a pill to get anything in the cat. How do you,
Do you have where the pill is? So you can get, particularly for cats, works and dogs too, it's this kind of a little stick that has a little space at the end that you put the pill in, and then on the other end it has a little plunger. You open their mouth, and then it's in, usually. These are fluid sets that can be used for IV fluids and subcutaneous fluids, which we'll be talking about later. This one's just saline. That's a pretty good one that covers most cases in animals. But the main thing is you need the bag, the extension, and then something to put it in the animal with. So sometimes people think it comes all in one, but a lot of the time you have to buy it all separately. And then some other things that are a good idea to carry is ear drops, eye drops, and skin ointments, because ear infections are very common on boats because it's often humid. Cats probably aren't in the water so much, but the dogs are often in and out of the water, and ears get humid and then they get infected.
Same as used in humans on those drugs?
Generally not, because humans don't tend to get fungal ear infections very commonly, and dogs do get like a yeast infection very commonly in their ears. So I would try and get a veterinary one that has an antibacterial, antifungal, and anti-inflammatory. And that way, when you're not sure which type of infection it is, it's just an all-in-one and will treat everything. Eye drops wise, the other thing you've got to be careful of with human eye drops is a lot of them have an anti-inflammatory in them as well as an antibiotic. And if there's a scratch on the eye and you use the anti-inflammatory, it tends to make the scarring and the ulcer get deeper and deeper and deeper. So it's better to just use a plain antibiotic if you're not sure what's going on in the eye, rather than risk that could be happening. A humectant is really just like, like the natural tears type stuff. And in most cases, if you can even just use like a natural tears in eyes, that gets a lot of them better if it's just something minor. Skin ointment wise, carrying something just like a Neosporin where it's just a good antibacterial ointment is good. But having something that is an all-in-one, kind of like the eardrops, where you've got an anti-inflammatory, antibiotic, and antifungal is a good idea as well. When they're getting those, like, if the dog gets like one of those hairless, losing fur skin spots, you're kind of covering your bases with that, where you're getting the inflammation and itching, but you're also treating if there's, a fungal or bacterial infection. Neotopic is a brand of a veterinary brand that you can get, but there's some human versions as well that you can probably just get at the pharmacy. And a lot of those, most veterinarians here are very willing to sell eardrops and eye drops and things over the counter so that you can use them if needed. So before we do any first aid, we need to know what's normal for our pets. And this is a good thing to check, every now and then just listen to your dog or cat's heart, just check their gums so you know what's normal for them. Some cats, for example, have a little bit paler gums and that's normal for them. Some dogs, when they're excited, will have quite red gums. But basically, temperature is important because we want to know if they have a fever. If they have fevers, we can use anti-inflammatories, but it might also indicate that they have an infection or something. Temperatures are taken rectally in dogs and cats. That's the normal value there. Normal heart rates are a bit different for different size animals. But if you don't have a stethoscope, in this picture up in the corner, you can see they're just kind of holding over the chest. And you can usually feel the heartbeat in most animals as well, so that's a good way to take the heart rate. A respiratory rate is also a good thing to take, especially if you're worried your pet has anything going on. Say for example, you worry they might have, inhaled a bit of water or something like that. When animals are resting, they should have a respiratory rate under 30 seconds. If they're resting and calm and it's really fast still, that usually indicates that they're not getting enough oxygen. And their gums are really useful. You can detect anemia, dehydration. If they're purple, that means they're not getting oxygen. They should be pink and moist, so if they're anything but that, something's wrong. And when you press the gum, just like on my arm, when I press it, it goes white, and then within 2 seconds it goes back to its normal colour. You can do that on your dogs and cats' gums, and that helps tell you their blood pressure and circulation is normal. So if it's taking 4 seconds, it means they're either dehydrated, or their blood pressure is low, or their heart rate is low, something is going on. So that's something very easy you can do just to check how things are. So, CPR. We hope we never have to do it. And I'm going to start by telling you, even in a veterinary clinic, when we have all the drugs to give as well as performing CPR, it has about a 5% success rate. So, it's scary to know that, but I think good to know that as well.
Do you defibrillate?
No, we don't tend to. We tend to just use, the drugs to get the heart going again. Really important to ensure it's necessary. Once or twice I've heard stories of people CPR and like a very sleepy dog, so just make sure that they definitely need CPR. Some things you can do to check that they need it is touching the corner of their eye and seeing if they're blinking. Usually if they're responsive to that, they're probably breathing and breathing. Obviously checking for a pulse and for a heart rate. So again, like I said, you can feel for a heartbeat. You can even just put your ear against the chest and hear a heart rate. Dogs also have and cats both have quite a strong femoral artery. So when you feel the inside of their leg around here, you can often feel their pulse. There's kind of a little gap in between the two muscles, and there's a little pulse there that you can sometimes feel. And watch them for 15 seconds. Just watch and see if they take a breath before you jump right in. But if CPR is necessary, pretty similar to people, most dogs and cats, we lay them on their side, extend their head, check, do a swipe in the mouth and check for foreign objects inside the mouth or water or anything like that, pull the tongue out. And just to mention, dogs and cats, have an Adam's apple like us. There's some bone structures here. And if you put your finger down the back of their throat, sometimes it feels like there's something there, but it's actually that. So check it's foreign before you pull too hard. Yeah, check for breathing. If either they're taking very shallow breaths where it doesn't seem like they're getting any air, no breaths, or there's no pulse or heart rate, that's when you start CPR. If they have a pulse and a heartbeat but they're not breathing, there's basically breathing resuscitation that you start with. If they have no pulse, then you start chest compression. So we'll go through that a little bit. So with breathing resuscitation, again, they're on their side, head and neck is extended, and basically what we do is we breathe in through their nostrils. So we cover their mouth and hold it closed, and we more or less seal around their nostrils and breathe in. For a dog like Barney, you'd only be doing little breaths because he's very little. For a larger dog like, I'm sorry, I don't know.
Her name's Lapa.
Lapa? Oh, oh wow, she looks great.
Well,
That's very good.
she's had her surgery. So.
Oh, good. Yeah, so for her, one of your breaths is probably pretty close to the same amount as her, so she's going to need a bigger breath. Once you've done the breath, you just pull away and the chest naturally deflates. Basically, when you first initially do it, just with 3 breaths and then stop and see if they start breathing, because especially like in drowning cases and things like that, sometimes they do start breathing very quickly. If not, basically we do 10 breaths per minute. Every 2 minutes, stop for 15 seconds and check for breathing, check their pulse, because obviously animals that aren't breathing eventually their heart can stop as well, so checking both of those things is important. And the other thing to know is because you're breathing in like that and we don't have a tube down their throat, sometimes some of the air will enter their stomach, so if you notice that their abdomen's getting bigger, you can just gently press the air out and continue, because if the stomach gets too full of air, the diaphragm can't move down as far as it should, and then you're not going to be getting as good of breaths. Scary, I know. Chest compressions. I have staying alive up there. I don't know if it's the same people, but that's it. Yeah, that's basically the beat. Staying alive. You're trying to do about 100 beats per minute, and that song, I guess, is about 100 beats per minute. For small dogs and cats, pretty much go as fast as you can. You're not going to be able to go that much faster than 100, but their heart rates are faster. For little dogs, say like a dog Barney size or a cat, I would do it like that first picture, where you're actually just using one hand to compress them. So you don't need to do these only tiny. So basically you're just holding over where the heart is, which is kind of just behind his front leg there, and you're compressing. And what we're trying to do, we're not really trying to pump the heart per se, we're trying to compress the chest, which compresses the heart. So you don't have to be directly over the heart for it to work. You just need to be pushing the chest in far enough that the heart's getting squished through the action. Often with smaller dogs, we can almost pump the heart directly, or cats, but in a dog like Lapa, you're not going to be squishing her heart very successfully because she's so big. And so for a large dog like her, we're actually going to be doing it over the widest part of her chest. So rather than going over her heart, you're going over the widest part of her chest, and you're trying to compress about 1/3 of the way down, and that will just get the circulation going. For a large dog, you can use both hands, so kind of stage it in between depending on the size. Bulldogs, Lapa's not quite there, but the bulldogs where they have a really big chest, we often do them in basically external reconnaissance. We actually put them on their back and do it like a human, because you can get better compressions on a really big, deep-chested dog. If you have 2 people, one person will be doing the breathing while one person's doing compressions. If it's just one of you, do your compressions, and then every 30 seconds we stop and do a breath. If you're doing it with 2 people, you can attempt to kind of see if you can time it, but sometimes you just got to stop for 1 second, break, and then go again. And every 2 minutes again, stop, check the pulse, see if you're getting success, if not, continue. And if you are getting success and the heart rate starts again, just monitor it while you get into veterinary care. So first of all, with bleeding, apply firm pressure. That's just like in people, applying firm pressure is the thing. So I'll talk a little bit more about bleeding in a second if that doesn't work. Apply firm pressure for 3 minutes and then pull away and see if it's clotted. A lot of the time that is all you need to do for a bleeding wound that's not a huge wound. If the bleeding continues but it's just a minor ooze, putting one of those non-stick pads like this guy over it and then wrapping it will often be enough, the pressure will often be enough to stop it. The main thing is with an oozing or bleeding wound, we want to change bandages pretty frequently, especially if you're starting to see anything, if you see strike through, where you see liquid in the bandage, it needs to be changed right away. Otherwise, every 24 hours for oozing wounds. For an open, non-bleeding wound, like I used, so the photo in the bottom is a dog with a cut on its leg. It's kind of deep, stopped bleeding. That would be something I would bandage. Whereas the one on the top, the one on the top there, behind the cat's ear, that's a wound I wouldn't bandage. So it's hard sometimes to make a distinction of when to and when not to. If it's on a leg and the dog or cat's in the wing, bandaging it's often a good idea just to stop them, getting at it. If it's in a difficult spot to bandage, or it's quite a dry wound, or even in some cases if it's a bit of a wet wound, if we bandage it forever, it can stay very moist, and then sometimes that can delay healing. So it's hard to give exact when to do and when not to do, but for all wounds, flushing them with saline or clean water is a really good way just to get any surface debris, surface gunk off of them. And then using tweezers to just, a lot of the times with dogs and cats there's fur in wounds and things because they're fluffy. And then using something like diluted iodine, chlorhexidine, even oxygenator, hydrogen peroxide to clean it is okay. The main thing with cleaning wounds is it's a good idea to clean it every day especially if wounds have a lot of pus and exudate from them. But you can over-clean, especially with things like hydrogen peroxide. It can actually kill healing cells. And so if you're cleaning it over and over and over again, it can delay healing. So usually after 1 to 3 days, it's a good idea to start using one of the antibiotic ointments instead of over-cleaning. And yeah, as I said, with the bandaging, it's sometimes hard to know when to bandage and when not to, but if it's a limb and it's easily bandaged, bandaging it for a couple of days isn't going to hurt, especially while it's in the initial stages of healing. So yes, bandaging.
There we go.
Making sure the wound is clean and dry is a good start, and trying to bandage like anything wet will just end in disaster. So making sure it's as dry as possible. If you have a hairdryer even, is a good idea. Applying an antibiotic ointment if there is a wound is a good start. Then we use our non-stick layer over the wound. And then this inner layer of bandage, I really like this stuff. It's basically like a cotton wool kind of bandage. But anything that has padding and is absorbent is a good next layer, because that way if the wound is having exudate and pus, it's going to absorb it. But also if there's some sort of injury, like say you're bandaging because they've got a fracture or something like that, this provides a lot of padding and cushioning for the wound. So the main thing with dogs and cats is any extremity, we want to start at the toes and work our way up. And same with the tail, start at the tip, work your way towards the body. This basically just helps with circulation. If you go the other way, it's much more likely to cut off circulation. So we go up. And using the appropriate size bandage is important. So this size bandage would be good for a dog. If I was bandaging Lava's legs, I'd be happy using this. For Barney though, I would probably want something more like this size, just because this is going to get, on his little legs, is going to get really crinkled up because they're just so small. And again, on a big dog, if you're using really thin ones, it's a lot more likely to tighten, and then you've got more risk of causing like a constriction with the bandage. So we go up, and then this is our next layer, but again, like I said, you can use that kind of elastic stuff that comes in the human first aid kits. The main thing when you're putting on the outer layer of bandage is it's tempting to pull and go tight, but it's better to keep it, you want it firm, but you don't want it tight on the leg. So what I like to do is pull out what I need and then roll it back up, so that when I'm doing it, I'm not tempted to pull it out every time, because that's when you can get bandages that are too tight. Once you've got your bandage on, so you've bandaged from the top, from the bottom up, possibly done a few layers depending on, if it's a fracture, obviously we want a pretty thick bandage. If it's just to protect a wound, it might not need to be so thick. Once you get to where you're going, to the top, you can just put a thin strip of elastoplast around the top to try and stop it slipping off, and that tends to be the best way to keep the bandage from coming off. And when possible, if it's not a toe injury, we often try to bandage with just these two little toes just sticking out, and that's mainly so because it's really easy to check for swelling. So if you can just see the tips of those toes and they start looking like they're getting swollen, you know your bandage is too tight, you can take it off. Obviously with toe injuries you may have to incorporate them in, but let's see. Something none of us want to deal with. Obviously get to a vet as soon as you can. The reality is setting a bone is, even under an anaesthetic, a dog that has a fracture, normally what we have to do to reset the bone is we often will tie their leg up and use their body weight to slowly stretch the muscles out so we can even get the bone back together, because there's so much muscle contraction. If a fracture is unaligned, it ends up like this, and trying to pull it back into line without an anaesthetic would be nearly impossible, because obviously the pain is going to cause even more muscle contraction. So trying to set a fracture at sea is just probably not a reality. The other thing is, if it's not too rough, if the dog can stand on 3 legs and is happy standing on 3 legs, again, sometimes it's better not to bandage and to just leave it until you can get to a vet, because again, trying to bandage a fractured leg is not always super easy without something to sedate the animals. And obviously if you and your vet have organised sedation and you know what to do with your animal, that's great, but trying to give advice on sedating all animals is really impossible, because it's so, it's such a fine line between it being safe and not safe. So if you do need to bandage it, so say for example it's open, or perhaps it's rough and so they can't stand on 3 legs, apply a muzzle or have someone put a towel over their head, something like that, because it's going to hurt. And you pretty much do it in a very similar way to any bandage. The main thing is with this layer, the thicker the better. So we want that to be quite thick, because we're trying to basically have enough bandage material that it stops the fracture from moving. You can also use splints. If you're going to use something to try and stabilise it though, like a piece of wood or something to stop movement, apply a lot of this first. So you want that nice and thick, then put the splint, apply more of this, and then apply your outer layer. And that way you're not having something digging into their skin tightly. The other thing that's really important with bones too is if they do have an open fracture, so if it's opened through the skin, it's actually better to just not clean it, especially if you're somewhere where you could eventually, if you're going to be able to get them ashore in a few days even. Because by cleaning the wound, you can actually push, if you're trying to flush it, you can actually push the bacteria from the outside of the wound into the bone. And once you have a bone infection, it's very, very difficult to get rid of. So it's often better to just stop, put something over it, stop the bleeding, wrap it up and get to the vet. If you've got something like meloxicam or carprofen or one of the pain relief drugs on the boat, obviously give it if they've hurt themselves. That will really, really help. And if you can give it and wait 10 minutes or 20 minutes before you start doing things, that will help a little bit as well. And if there is any open wounds and they're looking infected, starting with your broad spectrum antibiotics is a really good idea. But like I said, it's one of those ones where in your mind, I think it's like, I just put the bone back into place and wrap it and it'll be okay. But trying to put a bone back in place is really, really hard. So, but if you can just get it stable so it's not moving around, that will help a lot until you can get to a veterinarian. But a lot of dogs in particular, and even cats with fractures, a lot of dogs will just happily stand on 3 legs, and a lot of cats will just tuck themselves up and not move, and often that's okay. If they're not doing more damage, that's probably enough. So bleeding. Pressure and bandage is the two big things to stop bleeding. Applying pressure for a long time really helps. So 3 minutes at a time, lift it off, see if it's clotted, if not, go again. If it's a really bad wound where it's bleeding, you can apply pressure in the armpit and in the groin of the animals. That's where they've got 2 large arteries, and so you can gently apply pressure and actually cut off the supply, a little bit of blood, while you hold the pressure on, and then try and check for clots again. Tourniquets are a real last resort, because there's a myriad of things that happen after you've applied a tourniquet that can make life really difficult. One of those is that you can cut blood supply off long enough that necrosis occurs of the tissue, and then the leg can die. But you can also get reperfusion injuries where you've cut the supply off and a lot of bad toxins are building up because there's no oxygen. Then you take it off and all of those things start circulating through the body and can produce shock among other things. So it really is, you know, if they're bleeding out, you put a tourniquet on, but if it's just kind of, you're like, oh, there's a bit of blood, you know, hold pressure. The main thing if you do a tourniquet is it needs to be a really thick bandage material, and it's similar to humans. We go around twice, puts a stick or something in, and twist it up to apply the pressure so it's very tight. Every 20 minutes it should be loosened for 20 seconds, and that's basically to allow some blood in so we don't kill the limb. If you go longer than 20 minutes, things will start dying. And yeah, like I said, very last resort. With internal bleeding, they're really short of opening things up to stop internal bleeding. There's really not much you can do except to keep them very, very quiet. So if your pet's had an injury, like, you know, say the boat is tipped and they've gone flying across the room and you're worried that maybe something has happened, just getting them calm and keeping them as quiet as possible is the best way for the body to clot, because most things will clot eventually. If the dog doesn't have a bleeding disorder, things tend to clot. A lot of people see blood in poo and think that's a sign of internal bleeding, and it almost never is. If you see red blood in poo, something's bleeding very close to the colon or anus, and so it's generally not internal bleeding like how we would normally think of it. Generally, if they've had an injury that's causing internal bleeding, it's actually going to be pooling under the skin, so it's going to be, they'll show bruising, or it'll be sitting kind of around the organs, so you don't really see symptoms per se in terms of outward signs of bleeding. What you'll see instead is the gums will start getting pale, so that's a good sign, and like I said, you might see purple colouring on their skin, and they'll be really lethargic, so they're more the signs we'd be looking for. Obviously, if they are coughing blood, that can be a sign of lung injury, and again though, for the most part on a boat in terms of what you can do, it really is just keeping them quiet. I threw in about the nails. This is a really common one. Nails get cut too short, it's very common. Something really easy is put a bit of flour on the end of it, or drag it through a bar of soap or through a bar of wax or like a candle. That usually is enough to just put a little clot at the end of it and stop the bleeding for long enough that then their body clots and it will stop. If that doesn't happen, you can apply pressure and that will generally do it too. You can get also those styptic powders and like the stop bleeds and things like that. Those are good for nails. I know people put them in wounds sometimes, but the way they work is by burning. And so when you put them in a wound, if it's a real deep cut, it's not going to do anything anyway because the blood's going to just keep coming and washing away. All it will probably achieve is burning the wound around it. So those, we generally wouldn't put styptic powder on anything serious because it really is just for the most part kind of creating a surface burn, so it helps with like very minor things and with the nails, but it's not going to work for a deep cut and will probably just cause more problems to fix later. So generally pressure and putting a bandage on is the way to go. So near drowning, this is an important one on the boat. That's me and Addie. Life jackets are important. Addie is my brother-in-law's dog who came on the boat for a little while with us. So it's pretty similar to the CPR. You're going to lay them on the side, extend the neck, pull the tongue out, check there's nothing in their mouth. If possible, having their head a little lower than their body will just help the water naturally drain out. Push on basically do a few chest compressions to try and just get any water out. And then if they're not breathing or they don't have a pulse, initiate CPR like you would have in any other situation. So if they're not breathing, start doing the breath resuscitation. If they don't have a pulse, initiate normal CPR. Something really important is, just like people, pets can recover from drowning in the moment and then later get sick again. So particularly in salt water, we can get a lot of things like really bad electrolyte imbalances after the fact because there's salt in the water as well that's getting absorbed, and the salt can also sit in the lungs and draw water in again. I don't know if any of you have heard of dry drowning, where people seem recovered from drowning and then later drown again when they're sleeping because essentially what's left in the lungs can draw the water back into them later on. You can also get pneumonia, gastrointestinal distress is really common because they swallow a lot of water as well, so they've got the salt water sitting in their stomach, and so that can lead to diarrhea and vomiting. So basically, if your dog's nearly drowned on the boat, but then seems fine, but you're somewhere like this, good idea to just take him to the vet anyway, just to make sure everything's actually how it should be. So it's just a cute little photo. I originally found a photo of a dog vomiting, and I was like, oh, people don't really want to see that. So I found a cute one instead. One of the best things you can do in a dog that has vomiting and diarrhea is just not feed them for 24 hours. For very young animals, and sometimes for very small animals, we'll do a little bit less time, so combining maybe 12 hours is long enough. If you have kids or puppies, we only do cold food for 4 to 6 hours, but most adult dogs or cats can very safely go 24 hours without eating, and it just basically gives the gastrointestinal system a time to just settle down. So sometimes 24 hours without food, and then you start feeding them again, and they're fine. It's kind of like us, if you're vomiting, you don't really feel like eating. A lot of dogs will still eat anyway, and that tends to not do them a lot of good. So withholding food is a good start. If after 6 hours they're not vomiting anymore and you're worried about dehydration, you can start giving them water or an electrolyte solution. Small dogs and cats will tend to do about 5 mils each time, every 2 hours. For larger animals, 10 to 15 mils. And if the vomiting continues, an antiemetic is a good idea, an anti-nausea drug. So like I said, metoclopramide is a really good idea, is a good one that often we have on the boat for people sometimes, or you can get it in the pharmacy. Serenia is also a really good choice for dogs. It works very well and lasts for 24 hours. It's very safe. But yeah, antiemetics are a very good idea if they've had vomiting. But generally, if your dog's vomited once or twice, try just withholding food, and often it's enough. But if they're really, vomiting, getting them on an antiemetic is a good idea. In terms of anti-diarrheals, I almost never use them. It's usually that thing of it's better out than in. If they have diarrhea, there's usually a reason. Either they've eaten something that doesn't agree with them, they have an infection, there's usually something they've maybe swallowed a bunch of salt water, whatever it is, generally that thing is better to be outside of them than inside of them. You can use loperamide in Imodium in dogs and cats, but again, it's just there are side effects with a lot of the anti-diarrheal drugs, and most of the time they're just not indicated, other than to just stop having diarrhea all over the boat. It's probably more for us than for them. It's usually better to let it pass. There are a few veterinary anti-diarrheal drugs that are a little safer to use than loperamide, so if it is something you're worried about, having something like that on hand isn't the worst idea. But like I said, even in veterinary practices, I almost never give an anti-diarrheal. I just control vomiting so we can get them eating again eventually, and that's it, and let the diarrhea run its course until it stops. If your dog has or cat has had vomiting for a few days or diarrhea for a few days, the other thing once you control food is doing a bland diet. So for dogs, boiled chicken breast with white rice is generally very well tolerated by their stomach, really easy to digest. It's not very fatty, so whatever's been going on can settle. And for cats generally don't want to eat rice, so just boiled chicken is a good diet for them. And then the next slide, I think, talks about dehydration. Yes. So obviously one of the biggest concerns of vomiting and diarrhea is that it leads to dehydration. But also just being on a boat, if it's really rough, and it's hot, they just might not want to drink water because it's rough, and then they can get dehydrated. So to assess dehydration, we were talking about the gums earlier. Generally the gums are nice and moist. If they're very sticky or they're dry, that can be a sign of dehydration. If their eyes are sunken, that's usually a sign of quite severe dehydration. So if you're starting to see sunken eyes, then that's a sign of severe dehydration. But the easiest thing to do is a skin tense test. So basically, on the scruff of their neck is usually a good spot to do it. We're pinching their skin, and we're seeing if it just goes back straight away. I might be a little it's dry in here. But basically, it should return right away. If it's taking a second or two to go back, they're mildly dehydrated. If it's taking a few seconds, a bit more severely. If you pinch it and it just sits up and stays there, that's usually a sign of pretty severe dehydration. So we want to correct that, obviously. If they're not vomiting, do the oral electrolyte solution, because that oral fluids do rehydrate just as well as intravenous fluids, provided that you're keeping them down. So that's definitely the easiest thing to do is doing oral, an oral electrolyte solution to try and rehydrate them. If they're vomiting or severely dehydrated because they're sick, sometimes intervening more is needed. So here's my fluid bag. Now, I didn't even put in this how to do intravenous bloods. I can definitely show you at the end the cephalic veins and things like that. But in most animals, one of the easiest ways to give them fluids is subcutaneously. Particularly if you're on a moving boat, hitting a vein, like in a dog like Barney, he's going to have teeny little veins, not super easy. And in cats as well, try to pin a cat down to hit a vein, not funny with their vein. And once they're dehydrated too, their veins are going to be, they're going to be really small, they're going to be hard to get. Subcutaneous fluids are a lot easier. And so basically what we're going to do, you can see this, that's a skin test in the cat, but in this bottom one, you can see they've kind of made a tent with the skin. So you're picking up the skin on kind of in between their shoulder blades over their neck, and it'll make a little tent. And basically what you're going to do is hold up the tent, pop your needle into your tent, and it'll be under the skin. And then you just open your fluid bag, which is like this, hold it up high, and the fluids are just going to go under the skin. And they absorb really well under the skin. So if you can do that, we do, like often in puppies and kittens where they're like trying to maintain an IV on them is just really difficult because they're so tiny. Giving them subcutaneous fluids is really easy. The main thing is we don't want to give more than 100 mils per area. So what we often will do is do a little bit to this side, fill it up, and they'll have a ball there, like they'll look like a cat. They'll have this little ball of fluid, but over an hour or two, it'll just go away. And so in a large dog, you can actually do a few spots. So they're going to have, like a dog like Lapa has a fair bit of skin free. So anywhere you can get in under the skin, often it's like these kinds of areas are the easiest. Some dogs also have a lot of skin kind of around their butt area that's a bit more easy to get under. Cats are really easy because usually you can lift their skin like way up. For a cat, we usually do 50 mils twice a day. For a small dog, 100 mils twice a day. Barney, probably I'd go with more cat doses, he's really little. And large dogs, you can do 200 millilitres twice a day. But that's a really good way to get them hydrated that's a lot less scary than doing an IV. The main thing with IVs is if you're doing an IV, it needs to be prepped. So on most animals, it needs to be shaved, it needs to be cleaned and sterilised. Then you've got to try and get in the vein, tape it off, keep it in, because what sometimes happens is if it works its way out, it'll actually then go subcutaneous, but because the leg doesn't have a lot of spare skin, that can be a little painful. And obviously when you do an IV, you can introduce infection into the vein, so it's really important to be sterile. When you're doing subcutaneous fluids, as you've seen at the vet, when they give you a dog a vaccine, they're not sterilising the area like crazy because for the most part, you're not going to introduce anything too bad under the skin, the body can fight that. So it's very hard to cause a lot of damage doing this basically. So I think in terms of, if you've not got medical experience, obviously human nurses, vet nurses, doing an IV might not feel so scary, but this I think is just a really easy way, and we do it a lot, especially in wildlife, little animals that are hard to get veins on, that's something we do a lot. So I was going to say at the end of the talk too, we can always bring some of the dogs up and I can show you show you on them if there's any questions.
And you're using a syringe when you do that?
Yeah, so you can use a catheter. I actually brought a catheter in case anybody wants to look at it. The main thing with a catheter is, this is a big one, we were using this for the turtle. Because it's plastic, once it's in the skin, it can bend and block itself. So I often will use a needle, and I'll just put it in about that far, and then I just hold it in the skin. So then I just flatten it on their back and just hold it there. The other thing that's really nice that I have on the boat, I forgot to bring them, is butterfly catheters. So they're a catheter that basically, they're usually quite small, and they're called butterfly because they have a little pieces of plastic on either side of them. But they have a little extension set that can be attached to the fluid bag, and those can be put under the skin. You basically pop the catheter under the skin, hold that little butterfly part against the skin, or even tape it against the skin, and then set your fluid bag up and leave it. The main thing, like I said, is to just make sure how much you're giving. And in small animals especially, you can also buy 60 ml or 100 ml syringes, so you can even just actually inject it in. The good thing with this is, I guess, worst case scenario is you hit a vein, in which case you're going intravenous. So it's for the most part pretty safe, because intravenous fluids isn't bad either. So Yeah, so for me, I just think if if you're not sure, subcutaneous fluids is just so much easier to do.
If you're using one of those fluid bags, so how do you measure how much you've put in?
Oh, so they actually have on the side of them, like this says 500, 400, 300, 200. So as the bag goes down, it'll tell you how much has been given usually. Yeah. So and if not, you could probably estimate it more or less with, if you know it's a 500 ml bag, divide it into 5 and yeah. It won't do a lot of damage if you give a little more or a little less. The main thing is the comfort for them because they can only tolerate so much under the skin at in any one spot. So, and for little animals, 200 milliliters is a lot of water to carry around on their backs. But if it absorbs really quickly, like if you do it and you come back an hour later and it's all gone, it's probably a sign you're quite dehydrated, in which case you can even do 3 times a day if necessary. But this is the technique we teach a lot of people who have cats that have kidney failure, because a lot of those cats have to get subcutaneous fluids at home because bringing them into the vet every 2 days is really stressful, but their kidneys need a lot of fluid to flush out the toxins because they're not working properly. So my auntie, for example, did this every 2 days for 6 years on her cat. Her cat would come and lay on her. She had a heated bed that the cat could only use when it was getting subcut fluid, so it was the way to convince the cat it liked it. And she would lay there, get her fluids, and then off she'd go. So it really is quite tolerable for them.
So when the dehydration, but I'm just trying to figure out what would be the cause of such a severe dehydration?
Usually vomiting and diarrhea.
Okay.
Yeah. So it would be unusual for like a heat stroke. Sometimes heat stroke can cause really severe dehydration. So say for example, yeah, exactly. Like say you left the boat for 10 minutes, thought you were leaving for 10 minutes, and then a giant, something, thingy motor removes, and then you don't come back for 2 hours, and the dog's been locked in the boat for 45 degrees, something like this. They could get dehydrated, but vomiting and diarrhea are the most common causes of that dehydration. So, say for example, they've got vomiting and diarrhea, and you've tried giving them the antiemetic, and they just keep vomiting. This might be something that they need to just get them through, until you can get to their care.
Thank you.
That's all right.
And sorry, I had to come in a little late, but with the skin, so you just pull the skin, and if it goes back to normal quickly?
Exactly, yeah, so it should kind of spring back right away. If it takes a few seconds, they're dehydrated. If you do it and it just stays, which it will do if they're really badly dehydrated, it's usually because it's quite severe. So that's one of the easiest tests to do to check for hydration. And if they will take, like I was saying, they will take oral rehydration, just get them drinking. That's not a big problem. Even if you've got to flavour it a little bit, put a little chicken broth or something to get them drinking, that will help a lot. So poisoning, we're just going to talk about briefly. Dogs mostly, cats don't eat as many weird things, but dogs particularly do. If it's a non-caustic substance like chocolate, if they've gotten into the pill, like a bottle of ibuprofen or something, we do see dogs with recreational drug poisoning sometimes. For dogs, you can use hydrogen peroxide to make them vomit. So this is a fairly easy way if your dog's just eaten something that, like I said, you come back and you're like, oh, he's just eating like 100 ibuprofens or Panadol or something. That is a good way to get them to vomit. The main thing to know is it can cause gastric irritation because it's hydrogen peroxide. So, there are some side effects, but if it's, the difference between them getting really sick or not, it's worth it. It's only useful if they ate it within the last 2 hours. If it's been longer than that, there's a good chance it's already worked its way through and is being absorbed, in which case not going to help. Unfortunately, hydrogen peroxide, cats are a bit more sensitive to it and they get really bad gastric ulceration from it, so it's not really an option for cats. There is no good option for cats, unfortunately. Whenever possible, seek veterinary attention. And I will just mention with chocolate, people get really worried about chocolate. They have to eat a decent amount of chocolate to get sick. So like a 10-kilo dog, if they eat like a small size chocolate bar, they'll probably get maybe a little diarrhea and that's it. They kind of need to eat, a Barney-sized dog, if he ate the small one, might start to show more severe symptoms, but like a Lapa-sized dog, if she eats a bar like this of chocolate, probably won't even notice she's done it. So it's just good to kind of have a rough idea in your head. There is a chocolate calculator online that's very good. You just enter your dog's weight and it tells you all the different coloured chocolates and how much they have to eat of them to be sick. So that, not the worst thing to know. Because white chocolate is better than dark chocolate, so yeah. If they've eaten something caustic, so like for example, cats like bleach. If you pour bleach on the floor and a cat sees it and smells it, they'll want to lick it up for some reason, and it's obviously not good for them. If they have eaten a caustic substance, you don't want to make them vomit because then you're just going to burn the esophagus twice. So better to leave it in. Wash the fur, wash their face, wash their eyes if they've had anything caustic because it could be on their skin. And there's two options. Activated charcoal is a very good antitoxin. It's also something good to give if they have eaten something like ibuprofen, but it was, possibly hours ago. You can give them activated charcoal to try and reduce the absorption. The other thing though, if you don't have activated charcoal, is milk is quite a good antacid. So basically if they've eaten something caustic, trying to get them to drink some milk is a pretty good way to try and neutralise it in their body a bit. And then obviously seeing a vet for the secondary problems that might arise from that. I just threw this in because we have had this happen before. Sometimes they'll eat like really weird things like sewing needles. If that happens, obviously you need to get to a vet. But in the meantime, something you can do is feed them a bunch of bread. If they eat a lot of bread, it usually kind of just cushions the stomach. So if there's something spiky in there, it kind of sits in the bread instead of going to other places. So, and it kind of just sits, it's pretty slow to digest, so it just sits in their belly a little longer. So just a handy tip of if they eat something really silly, hands on this, but so. And this I know something that a few of you have had in your mind before as well. Straining to go to the toilet. So obviously the first step is trying to work out if they're trying to pee or poo because it's not always easy depending on, especially with cats, they kind of do the same thing. For male cats, a very common thing is that they can get blocked, like urethral blockages, and that can block their bladder from emptying, and then they are straining to go, and it can be quite life-threatening because if they can't pee at all those toxins that are trying to get excreted build up in their body, and then they get very sick. If that's the case, if they seem to be blocked, administering an anti-inflammatory can sometimes help. So it depends on how bad, if there's stones and they've got a bad blockage, not always, but the anti-inflammatory at the very least can sometimes reduce the inflammation enough that the stone or the plug can be passed and then they can start weeing again. So that's a good thing. Both dogs and cats though, stones, crystals and urinary tract infections are the kind of most common causes of straining to urinate. In most of those cases, a broad spectrum antibiotic and an anti-inflammatory will get it getting under control. So again, carrying a broad spectrum antibiotic and an anti-inflammatory on the boat will solve like 90% of the less severe problems that your pet could have. So it's a really good thing to talk to you about getting, enough for like a week of each just to carry on the boat for emergencies. So straining to poo. One big thing is to determine if they're constipated or irritated, because some dogs that have had diarrhea, or if they have in cats they can get colitis quite commonly. So if they have irritation of the colon, they'll be looking like they're trying to go all the time, but it's not actually because they truly have constipation, it's just that they feel irritation, so they feel like they need to go, but there's nothing there. So that's just something to kind of try and work out pretty easy on a boat, because you probably often see whether they're going or not. If they really haven't moved for 2 days, or if they're actually just straining in many, many places, it might not be real constipation. If they are constipated, the best thing you can do is hydrate them, because being dehydrated is one of the number one causes of constipation. Some other options though, canned pumpkin tends to be a really good stimulant. You can get little pet laxatives, so especially for cats, you can get ones that you actually put on their fur, you put it on their arms, and then they lick it off to clean themselves, and it's a laxative, and so that's an easy way to do it for cats. You can give them oil, so like coconut oil, olive oil, mineral oil, to get things moving. In severe cases, you can also use an enema. So Microlax is a little enema, you have to put it up their bum, and it works very well, in most cases of constipation. The main thing with an enema is that you want to make sure they're hydrated first, because obviously it can cause a little bit of diarrhea sometimes, things start moving, and so if they're dehydrated, you can, make them feel sick. And just a note, take care with different animals, because for example, a fleet animal has phosphorus in it and it can kill a cat. So it's, you know, one of those things like I was saying where if you want to like come up with your plans for different situations, running it through with your vet or a veterinarian just to say like, is this suitable for my pet, is a good idea just to make sure. And then I just want to talk a little bit about transporting pets in emergencies, because obviously if you've stabilised a fracture or you've done CPR and you then hopefully will eventually want to take them to shore or into a vet. For little animals, having a little crate is just the easiest way to move them around. You can pop them in, you can carry them around. It's very safe for them, it's safe for you if they're in pain or scared or anything like that. For larger dogs or animals that you can't put in a crate, consider muzzling them if it's a scary situation or if it's if they're in pain, especially just for the parts where you know if you're picking them up to move them and they have a fractured leg. If they're in a lot of pain and they're a bit disorientated, they won't necessarily want to bite you. They might just snap and then you might get hurt. You can use a blanket sling for larger animals, so basically just lay a towel out, put them on, and have 2 people at each end. But if you're worried, like say for example, you're worried about neck injuries, back injuries, you're worried they could have internal bleeding, you can also do a backboard where you use something solid, like a piece of wood, put them on a piece of wood, move them like that. If they aren't conscious or they're kind of a bit out of it, just make sure that their heads, they're usually laying on their side, is the best way to transport them. Make sure head's extended and just pull their tongue out a little bit, and that way you know their airway's nice and open if they're not quite with it or conscious. Moving them as little as possible is good. And then, we were kind of talking a bit about this, the ditch bag and life jackets and things like that. We're in a unique position on a boat where the emergencies we see may not be quite the same as the emergencies other people see, and so having your pet's needs in the ditch bag is a good idea. If they're on, if you've got an animal on heart medicine or kidney medicine, something like that, having a short supply in your ditch bag isn't the worst idea, especially something like heart medicine. If it stops suddenly, they can deteriorate really quickly, and if you're in a life raft, you don't want to be dealing with that as well. So, life jackets are a good idea. And something to just consider with cats and dogs is in scary situations, we can't explain to them what's going on. And so that's where having like a muzzle, even considering having a muzzle and a leash in your ditch bag and making sure you have crates handy. You can imagine a cat in a life raft, it's not going to be much fun without them in a crate. And even dogs, if it's a really scary situation and it's rough and it's dark and lights are flashing and things like that, it's going to be really scary for them, and they might not act, even the most well-behaved dog may not act like how they would normally act. So having something to pop on isn't the worst idea. And honestly, possibly even keep some Benadryl in your ditch bag, because Benadryl is also a sedative, so stops motion sickness. It acts as a bit of a sedative. If they're really freaking out, give them the Benadryl or stop them vomiting. It might just chill them out a little bit. So, just kind of consider the situations that you might be in and have the things ready, because it's definitely not, the normal things that we experience. So, yeah, having a safe spot. Yeah. Oh, yeah. When I saw it, it was just called like a pet carrier. It was like, I googled carrying pets, and that one came up, and I was
That's
like,
just me with my dog in my purse.
yeah. And I was like, that's actually kind of like a weirdly handy thing to have on a boat. It doesn't take up much space, yeah.
Well, and to get them off.
Exactly. And most life jackets for pets have the handles, and so that's even a way you could transport a dog that's injured. If you can get their life jacket on, if they've hurt a leg or something, even that will help you move them around without having to, touch sore areas as much and things like that. So blankets work well as well. You can kind of create slings out of blankets and stuff. Yeah, I think that's it. So yeah, like I said, we can definitely demonstrate